The new coronavirus. It's moving fast and it doesn't look good. What started in the city of Wuhan in early December has now grown into a global pandemic. It already claimed many lives and it is still spreading fast. So this is what the world is dealing with. A virus called COVID-19, which stands for Coronavirus December 2019, and this is what it looks like. It's like viruses we've seen before and comes from the same family as SARS and MERS. So what do we know about coronaviruses? Coronaviruses were first discovered in the 1930s when an acute respiratory infection of domesticated chickens was shown to be caused by infectious bronchitis virus, IBV. In the 1940s, two more animal coronaviruses, mouse hepatitis virus, MHV, and transmissible gastroenteritis virus, TGEV, were isolated. Human coronaviruses were discovered in the 1960s. The earliest ones studied were from human patients with the common cold, which were later named human coronavirus 229E and human coronavirus OC43. Other human coronaviruses have since been identified, including SARS-CoV in 2003, HCOV-NL63 in 2004, HQU1 in 2005, MERS-CoV in 2012, and SARS-CoV-2 in 2019. Most of these have involved serious respiratory tract infections. Coronaviruses are common and usually found in animals, but 6 of them were known to infect people. This new one takes that up to 7. 4 of those strains are pretty harmless and might cause mild symptoms like a cold, but SARS and MERS are killers. Severe acute respiratory syndrome, or in short, SARS, showed up in 2002 and killed 1 in 10 patients. Experts think SARS jumped the species barrier from the civet cat to humans through bats. Then SARS disappeared in 2004. In 2012, it was the MERS, Middle East Respiratory Syndrome, which kills roughly 1 in 3 people who get it. MERS is thought to have come from camels. And now, 2020, there's this new strain which we're still trying to understand. Let's get a sense of how we got here. This paper predicted the coronavirus in China almost 1 year before it happened. It was published in March 2019, but submitted for review on January 29th, and it has this statement. It is generally believed that bat-borne COVs will re-emerge to cause the next disease outbreak. In this regard, China is likely a hotspot. The challenge is to predict when and where so that we can try our best to prevent such an outbreak. The paper is titled Bat Coronavirus in China and published by 4 researchers from Wuhan Institute of Virology, Yi Fan, Kai Zhao, Zhengli Shi, and Peng Zhao. Later on February 7th, Chinese researchers confirmed that the virus could have spread from an infected animal to humans through illegally trafficked pangolins. Scientists have pointed to bats as the possible source. Review papers usually take a while to write, so this was predicted a year before China announced the outbreak on December 19th. December 2019, a Chinese ophthalmologist at Wuhan Central Hospital named Dr. Li Wenlian alerted that SARS-like symptoms were detected on a patient. He stated later that 7 confirmed cases of SARS reported from Hunan seafood market, and confirmed later that they were in fact coronavirus cases. He was stopped by the Chinese authorities and forced to sign a statement saying that his warning was an unenforced rumor, promising that he wouldn't commit any more illegal actions. January 10th, he treated a coronavirus-infected woman for glaucoma. Li was diagnosed positive 2 weeks later with coronavirus. On February 6th, confusion surfaced about his death. COVID-19 caught the world by surprise. This timeline shows how fast it spread through China and then to the world. December 31st, China alerts WHO to several pneumonia cases. January 7th, France confirmed Europe's first case. January 11th, China announces first death. January 23rd, the central government of China imposed a lockdown in Wuhan and other cities in Hubei. January 30th, WHO declares outbreak a global health emergency. February 2nd, first death outside China recorded in the Philippines. February 11th, WHO names the virus COVID-19. By the beginning of March, countries around the world started closing borders and restricting traveling. By the beginning of April 2020, China controlled the virus spread. At the same time, other countries in Europe and America reported more confirmed cases and deaths than China. To this date, COVID-19 infected more than 800,000 people, and claimed almost 40,000 lives. So how do you know if you are infected? Common signs of infection include fever, coughing, and breathing difficulties. In severe cases, it can cause pneumonia, multiple organ failure, and death. The incubation period of COVID-19 is thought to be between 1 and 14 days. It is contagious before symptoms appear, which is why so many people get infected. Infected patients can also be asymptomatic, meaning they do not display any symptoms despite having the virus in their systems. How can I protect myself? WHO recommends basic hygiene such as regularly washing hands with soap and water. Avoid touching your face and covering your mouth with your elbow when sneezing or coughing. Maintain social distancing, keeping at least 1.8 meters, 6 feet between yourself and others, particularly if they are coughing and sneezing, and avoid touching your face, eyes, and mouth with unwashed hands. Avoid unnecessary, unprotected contact with animals and be sure to thoroughly wash hands after contact. If you learned something new today, give this video a like, share it with a friend, and make sure you hit the subscribe button to get our future videos.